Council will come to order, please. Would the clerk please call the roll to establish a quorum?
Councilmember Ashby? Here. Councilmember Warren?
Here.
Councilmember Harris?
Here.
Councilmember Hanson?
Here.
Councilmember Chenier?
Here.
Councilmember Guerra?
Here.
Councilmember Jennings?
Here.
Councilmember Carr?
Here.
And Mayor Steinberg.
Here. Thank you all. Let me ask Vice Mayor to please lead us in the Pledge of Allegiance.
Very good. Be happy to. Salute and pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Again, welcome to all of you, and welcome to the members of the public who are tuning in on Access Cable. This is another unorthodox city council meeting for all the obvious reasons. And I just want to begin by saying how much I appreciate the city manager and the entire city team, as well as my colleagues, for continuing to serve the public in most effective ways during this crisis. I'm very proud of our city. I'm proud of how we are working to fill as many gaps in the impacts of this coronavirus as we can, and making a difference. And tonight we'll take action that I hope will lead to making even more of a difference for our most vulnerable population. We're meeting in this way for obvious reasons. We are trying to be role models here for how to maintain our physical distance. And I do want the city clerk to please describe how we are taking public comment and public input, and how we're doing our best to reconcile the public health imperative here with hearing from our public. Mindy? Mindy, are you there?
She's muted.
Okay. If you could unmute.
Thank you. I am going to share with you that members of the public are encouraged to view meetings online and to provide public comment digitally via e-comment. We do distribute e-comments and correspondence to council the afternoon prior to a council meeting, and those are uploaded to the agenda on our website. E-comments are still active, and any received after the distribution and posting of our correspondence during the live meeting will be displayed during each agenda item.
Okay. Thank you very much. So that is up on the screen, and I appreciate you clarifying that. Let's begin with our consent calendar. We have 21 items on the consent calendar. Do members have any questions about any of the items? I know I do want to make a comment on item number 3. Does anybody else? All right. For item 3, I just want to highlight, this is an action that authorizes the city treasurer to invest $50 additional million from the city's investment fund into local banks that are lending to our small businesses and participating in all the various assistance programs that are available for small business. And it's a big incentive, if you will, for our community banks and our local banks to be fully participating in helping as many of our businesses as possible in Sacramento during this time. I know that there's a lot of clarification that is being sought about how the SBA Paycheck Protection Program and other loan programs actually work, and they're getting it all up and running. But I know I'm going to be talking to our local bankers in the next several days to encourage them to continue doing everything they can to get these loans processed as quickly as possible. And item 3 provides an additional incentive to those who are really stepping up. So I just wanted to point that one out. Anybody else? Is there a motion on the consent calendar?
So moved. This is Councilmember Hanson.
Second.
Moved in second. Okay. Mindy, is there any public testimony to summarize on the consent calendar?
There was no public testimony received on the consent calendar.
Okay. Then let's call the roll on the consent calendar, please.
Councilmember Ashby,
Yes.
Councilmember Warren,
Yes.
Councilmember Harris,
Aye.
Councilmember Hanson,
Aye.
Councilmember Chenier,
Aye.
Councilmember Guerra,
Aye.
Councilmember Jennings,
Aye.
Councilmember Carr,
Aye.
and Mayor Steinberg.
Aye. So that passes unanimously. Thank you very, very much.
And Mayor Steinberg, the next item is 22, a public hearing, and staff has asked that we pull this item and it not be discussed this evening.
I was just about to say that city
Thank
manager
you.
and I have talked about this. We're going to continue this for a couple of weeks. Do we need a motion? No? Motion required?
No motion required.
Okay, then we will continue that without any objection. Okay, let's go to item 23, which is a continuation of our emergency declaration. Mr. City Manager? Mute.
Sorry.
Go ahead.
So this is just a quick update. Given that the county public health officer just extended his public health order, I'm recommending that we continue our local emergency declaration as well for another 2 weeks.
The item. Second.
Please call the roll.
I have a comment, if I can,
Yeah.
Mayor. So, and I know I've talked to at least one other of our colleagues. I know in the new emergency declaration, the public health director for the county talked about recreational facilities and keeping folks out of tennis courts, basketball courts, playgrounds, things like that. I've had lots of both conversation with the city manager about this and also with our community. We regularly see 5-on-5 basketball games going on with lots of kids on the sidelines as well. So, Mr. City Manager, I don't know if this is the appropriate place to bring this up. I'm not sure where else I would, but I think we need to be cognizant of this and take some action to keep folks out of these facilities.
So given the discussions I've had with the public health director, we are aligning our operations with this new order. And so staff is prepared to shut down those appropriate structures, play structures, and park amenities consistent with the new order.
Okay, thank you.
Mayor, may I speak?
Yes.
So, Jay and others, I know, we're all sacrificing a lot and we're asking a lot of a lot of people. And I don't think we should break the rules. So if the rules are to close the playgrounds and close the basketball courts, then we should do that. And it makes sense. And I get those same calls. But I also think we need to be really mindful here of what's happening around us besides COVID. Because, yesterday, 2 teenagers in Natomas decided to end their lives. And while COVID is right in front of us, one clip behind it is mental health. And I just want us to be really aware of what families are facing at home all day, trying to do their jobs, or maybe having lost their jobs, and also deal with teenagers who have now been out of school for a month. I know we have to close the courts. I have 2 requests. One is that we find ways to not judge people. And 2 is that we don't put our police department in a position of policing young people who are looking for an outlet, or moms who are on their last leg. I know COVID is the number one thing, but I can feel the beat of the heart in my district, and it is right on the edge. And I'm just asking us to be conscientious of that too as we proceed.
Mayor, I also have a comment.
Yes.
So I've walked around my district quite a bit in the last week, and I have seen numerous children playing on our play structures despite our warning signs, which have been rather small. I've talked to the city manager about this a lot. You know, I worry about the transmission of the virus, and certainly the county health officer, Dr. Bielenson, agrees that this is not safe at this time for children to be playing on play structures in our parks. So I've asked the city manager to take the step of cordoning off the areas with caution tape, because I've noticed, and I had discussions with parents today saying, you know, I realize you have a choice here, but you know, certainly from my point of view, allowing your children to play on structures that the city is not going to be able to sanitize at this juncture is a poor decision. And you know, I listened to Pro Tem Ashby's discussion about mental health, and certainly it is true. You know, still people can walk, people can play. You know, alternatively, I see family units playing in their yards, but it's really more about the contact with the structures that I'm worried about, and contact with other people, which is what Dr. Bielenson is so worried about. So it does make sense to close down the tennis courts, the basketball courts. We still have open fields, and we still have lots of wonderful open space in the American River Parkway to explore that people can do safely. So there are many outlets, but you know, personally, I feel that we need to send a stronger message to people that it's not just we're recommending that you stay off the play structures, but simply that you have to stay away from them for a while.
I think this is a really important discussion, and it's not right or wrong. I do want to highlight what Angelique did address here, and this is the mental health issue, especially around young people. As we take up the issue of the homeless and the homeless mentally ill in a few moments, I would like to engage as colleagues here, as a city, and with our county partners to see if we might free up some of those Mental Health Services Act resources to really elevate the mobile crisis youth hotlines, for example, that exist, that Angelique and her father was a part of starting several decades ago, and see what we might do to garner some resources, even out of the Donate for Sacramento fund, to really provide some more outlets for young people to be able to talk. Because if we have to restrict some of the ways that young people get out their stress, and it's not just young, but it's adults too, then we've got to give them an opportunity to talk to somebody about their frustration and what it is they're feeling. So maybe that's something we can do that is positive to mitigate the impact of what is really painful but necessary right now.
I have a question here.
Yeah.
This is Alan. Do we know if there's been any issues as it relates to these playground encounters in COVID? Is there any information that can quantify the impacts?
None that we're aware of.
And I know it might be hard as well, but I have a concern really also, and I know that all of us do, about the mental health aspect, as well as there are issues spiking up relative to domestic abuse and abuse with kids and so on and so forth. And being outside is, something I look forward to every day now, is going outside and doing what I do. But I think this is a delicate balance between um, kids being able to be kids and not be trapped in this adult of worldhood, and yet keeping them safe. And so I would really like to see someone who has some information, maybe health professionals and others, give us some feedback about the likelihood of what, kids playing on playgrounds and the virus uh, could equate to. And maybe there is some compromise, some middle ground that we don't have to be as definitive about, about the access for kids being able to play. So I mean, it's just a thought. I know, as the mayor said, I don't know that there at this point is a right or a wrong answer, but I think we do need to search for some balance.
I can certainly reach out to Sacramento County Public Health staff to find out some of that information. But and I haven't reviewed the order because it just came out during this call. So I will follow up and see if I can't get some information to share with the council.
Thank you.
I'd like
Howard,
to end
how-
to
what have we been doing so far? Have we put tapes around the playground? Have we taken the rims, the hoops down from the basketball courts?
We have not. We've only put signage up at the play structures advising not to use them for all the reasons people have talked about, and reminding folks to wash their hands, not touch their face, practice social distancing. But it sounds like this order is asking us to take another step.
how
And, and you're not clear on what the other step would be.
From what I understand, it is closing play structures, tennis courts, golf courses, playground equipment, exercise equipment, uh, and there may be a few others there, but we're taking a look at it now.
I'm sure all of us have been watching the news, how this virus has spread. And it's only a couple of ways through vapors from the mouth and touching something, especially a metal object that can carry the virus for up to 24 to 48 hours. I'm really concerned about the high number of African American deaths that are way out of proportion to the population. And our kids that I see on the basketball court bumping into each other, playing all day, they may not have the virus, or their symptoms might be very small, none at all. But they have parents and grandparents who could have decreased protection from this virus, or could have underlying medical conditions and bringing it home. I'm concerned about what I'm seeing with the kids on the court and then bringing it back home. So, Howard, when you figure out what the county is asking us to do, I certainly want to be in step with them. I think it would be a mistake for the city to be totally out of step with the county and what the other cities are doing. But we need to understand what the rules are going to be after your analysis.
I will. I'll send something out to the council once we've had a chance to analyze the new order.
Mayor, if I can add one thing.
I've been trying to get into.
Steve was next, and I'll get Jay. Sorry.
Okay.
Yeah. And Mayor, do you want us using the hand raising tool?
Yeah, why don't you, so that I can see? Mindy's texting me as well, so the combination.
First, I just want to come back to what Angelique said. Obviously, it's a tragedy for the families and those two teenagers that we've lost in the entire city community. So the real mental health issues, I think, are going to be felt in the things that people mentioned: substance abuse, domestic violence, all of these other things. And it's something really to be aware of. I do, having been in the public health world for a long time through some of my prior work, want to emphasize what Larry said and Jeff, which is that the way COVID is spread, there are a lot of people who are not symptomatic who are transmitting disease. The best science says right now it can survive on plastic and metal surfaces for 3, maybe 4 days. So we do, I think, have to find a way to abide well by the county order. But what I heard Angelique say is to manage enforcement in a way that doesn't use PD, that uses education, and that tries to keep in mind some of the various challenges people have. And so I agree, there is a disproportionate impact, it seems, on communities who experience lack of healthcare access, who are communities of color, as well as other impoverished communities. And I think we need to figure out how to ensure that they're getting proper access to testing, to the services they need. And that is something that I wanted to bring up. I've been talking to the city manager and the mayor about, which is I would really like to see, as we pursue the continued declaration here, a more assertive posture in relation to expanding testing. With the federal resources that have been earmarked for the city, it's something that we could do quickly, not only for our frontline employees, our essential employees, but for a lot of other people that may not currently qualify. The county just today did relax testing at its one mobile site provided by Verily, which is a Google subsidiary. But without mass testing, which is what worked in South Korea, I think we're really going to not know who's sick and who is very clearly. And the other thing, and Angelique brought this up as well, while there's been great work done by Eric and Angelique and others on childcare for kids 5 and over, we have a real crisis with people who have kids 5 and under, who have been asked to work from home. There are some resources where they could maybe take some paid leave. With the complications of the economy, I think a lot of parents are afraid to take paid leave, and they're stuck with not knowing how to take care of their infant or toddler while also trying to work, especially people who might have more limited resources. So I think those are two things: childcare under 5 and expanded testing that we should prioritize in this next phase of our work.
I'm willing to have a broader testing discussion about how we can partner with the county. I mean, again, they're in the lead, but that doesn't mean the city could not play a role. I think it's something we can agendize in
Yeah,
terms.
and Mayor, just one last thought. The city of Hayward used its own money and fire department to run testing. Testing is not, as I've looked around the state and country, not solely routed through one type of government. It's through health systems, it's through community clinics, it's through sometimes public safety departments like fire departments, the labs, and the other. It is an open source platform. So while we want to partner with the county and really understand, we have an opportunity to partner with the health systems, with the community clinics like WellSpace, and I think testing should be as accessible to every Sacramentan as we can make it, because that truly seems to be the inflection point for controlling this particular virus.
Okay, who was next? Jay?
Yeah, just real quickly, I just want to say that there's a fair amount of work going on right now with youth providers and talking to young people about what we can do to work with them and what we should be doing right now. Part of that too is moving a lot of the pop-ups into being virtual. We've experimented with that, and my hope is within the next couple of weeks we can come back with some recommendations or discussions, both to the council and to Donate for Sacramento, about things that we can be doing for young people. It's a huge problem, both for the kids and their parents. So definitely recognize that.
Rick?
Thank you, Mayor. I just want to kind of go back to the comments that have been made by my colleagues in reference to the delicate balance that we have. We're talking a lot about taking things away, and we've taken a lot away. At the same time, as we've just said, we need to make sure that we bring them things that they can do. And who better to hear what that is but from the kids themselves? I think with the pop-ups that we have and the partners that we have, why not have a survey out to the kids as to what it is that they'd like to do through this virtual world that we have them in, so that we can start providing those kind of opportunities for our youth to be able to participate in, and use this as an educational forum to make sure that they understand all the things that we've said today: the number of days that the virus lives on hard surfaces, on cardboard, on clothing, on all the different kinds of things, but use it as an educational opportunity and provide them with virtual opportunities that they come up with that will allow them to have the delicate balance that we're looking for.
Okay, what's the best way to do that? Youth Commission?
We've got our partners right now who are already, whether it's Youth Commission, and it can be a combination of all the above, the Youth Commission and our partners that are out there doing the pop-ups, to engage them in activities of finding out what it is our kids want to do during this time that we're in. How do they become a part of the solution as opposed to sitting there on the sidelines waiting for us to come up with answers for them? Let's make them a part of the solution and be proactive in that whole process.
And Rick, I'll call you later because all that work is actually happening
Yeah.
with the pop-up folks as well. So I definitely will talk to you. And
Yeah.
there's surveys going out as we speak.
And I think, between any of us who want to work on it together, getting those surveys, hearing from our partners, hearing from our youth who are trying to figure out what to do with their time, um, we can make this thing happen rather quickly. We can move forward. So I'd be happy to work with EJ on this. And
Eric?
anybody else that's on the table would like to.
Okay, why don't you guys go do and report back, okay?
Okay with me.
Yeah. Eric?
Thanks, Mr. Mayor. Yeah, at the Tahoe Park virtual town hall yesterday, the concern was could we barricade or whatnot? But obviously, that within the number of parks that we have throughout the entire city, that's just not a realistic option. But one thing that was a concern was the type of signage. So even if we could improve on the signage to be clear and more visible, that was a recommendation that came from the neighbors at the town hall yesterday. And then the second piece is that even Steve and I had talked about this earlier today. The many childcare centers, even the ones that we have helped fund in this last 101 businesses that got the city of Sacramento stimulus funding, are in a real critical area, a critical situation where they may not be able to be available for our workforce, and that's for the infant to toddler area. So, and we need to do a better job of connecting the displaced childcare workers with the available centers and at-home places that are available now. So I do think that we need to take a stronger role on that, because once we come out of this, we're going to find out that a critical part of our infrastructure may be gone. And we saw this similar to our construction workers during the downturn in the economy before. We shouldn't do that. That's going to have a ripple effect also with people getting back to work because of this. So working with SETA on that. But back to that point, I do want to work with Councilmember Jennings and Chenier on the youth piece.
Good. Okay. Please do. Angelique, Councilmember Estrie.
Yeah, thanks, Mayor. So I just feel like I want to make a couple of comments, and I know like this whole Zoom thing for me with these council meetings is really, I don't know if awkward's the right word, but I feel like sometimes one of us says something and then somebody else speaks up and like literally just whatever the other one said is just poof into the air. And I don't normally feel that way at council meetings, but I feel that way right now. So I don't know. That's more of just a comment, but I just want to be clear. Like, I'm not asking to break the rules, but I am asking you guys to understand that, and I'm just going to be really gender specific here. Moms are at their wits' end. And I am hearing from them routinely all across the city. I said 2 kids died in Natomas. I claimed them both. One's South Natomas, one's North Natomas. The North Natomas child is Twin Rivers. The South Natomas child is Natomas High. She's 15. He was 16. They don't know each other. They just both chose yesterday. I don't think it's a coincidence that yesterday marks 1 month of those kids being home. And you can put caution tape around the playgrounds, but a mom who's at her wit's end and has told a kid no to everything she can possibly say no to for the last month is going to walk underneath that caution tape. I have spoken to the doctors. I'm not sitting back here on my hands at my house. I talk to the head of UC Davis and the head of Kaiser all the time. They both would tell you It doesn't matter. You don't get COVID through your skin. I'm also married to an ER nurse. You don't get it through your skin. You get it through your mouth. The kids would have to touch their mouth. It's fine that we're closing them. I don't think we should break the order. I agree with you, Jay. We need to stay lockstep. But I just want you to understand, we could have also gone another route. We could have had kids wash their hands. We could have put hand sanitizer out there. And playing basketball, the order is very confusing. They want us to take down tennis courts and basketball courts and all that. Okay. But you know, if you have a sibling, you still could have played tennis with them. You still could have played hoops with your brothers. Now you won't be able to do that. Things are not equal. Kids in Meadowview can't go walk the American River Parkway. Kids in Natomas have great parks, and I still lost 2 kids. I just want us to be really aware. I have 800 youth in my youth crew of teenagers. So you can survey whoever you want. We've been in touch with them the entire time. We've run a dozen programs for those kids, everything from a bake contest at home to sidewalk art competitions. And we have hundreds and hundreds of kids participating in those projects. They're lonesome and they feel isolated. And now they're starting to feel desperate. And the distance education in Natomas Unified is superior. Every kid who needed a computer has it. Every kid who needed a hotspot has it. Every kid who needs breakfast and lunch, it's at every single school. Every kid who wanted a book got a book. It's still not enough. So what the mayor said to you guys about needing to get mental health into these homes has to be a focus. It has to be the counterbalance to everything that we're taking away. Otherwise, at the end of this, we can add to our body total those who died of COVID and those who killed themselves or died of abuse and neglect. And our abuse numbers in domestic violence are ticking up. In South Sacramento, day before yesterday, a murder-suicide, husband and wife. We can't just keep having these numbers tick up without us doing something about it while we're asking people to stay in homes. Homes are not equal spaces. Some people aren't safe in their homes, and we have to reach them and give them resources.
Angelique, thank you for putting it out there. And why don't we work together to bring back some enhanced mental health resource for our kids specifically in Sacramento?
Yeah, I'm happy to work with you on that, Mayor.
Larry?
Thank you, Mayor. Yeah, I think it's the couple that the murder-suicide in my district right around the corner from my house was an elderly couple. So I think it's not just kids who are suffering. It's everybody in the community, and I will work with you to do whatever we can to alleviate that issue. But the issue on the table for us is whether or not we want to extend the emergency declaration, and I move the item.
Who else? Raise your hand, please. Is there anybody else?
I'll second that.
Okay, Rick?
Councilmember Warren already seconded it.
Okay, Councilmember Jennings?
That was a second, Mayor.
That was.
But Alan Wayne Warren beat me to it as usual.
Mostly only in golf, Rick.
Which is now prohibited, by the way. So
actually, golf is still.
It's not. It didn't make it in the order, Mayor. I know it was in the draft. It's not in the order.
Yeah, it's still. Yeah. You just Rick and I couldn't ride in the same cart though.
Right.
He'd have to walk while I rode. I could work on that bad knee. I'm joking.
Howard, Mr. City Manager, as I'm listening to all of this and participating in this, I know that these virtual council meetings are hard to put together and the agenda items are about the necessary business, but it might not be a bad idea. And Jay, you all could help here to have an agenda item and a meeting about how we are attempting to respond to the needs of our young people during this time. Whether it is a discussion, more detailed discussion about how we are transitioning the pop-ups in the way that has been referenced a couple of times, a specific youth mental health proposal to ensure more kids who are really feeling it have a friendly and trained person to talk to what we are doing to transition our traditional city recreation programs as the summer approaches uh, to meet the incredible need out there. Can we do that?
Sure, I can help schedule that meeting offline.
Mayor, could we talk about childcare and testing as well? That's
Yes. Yes. We can talk agendize in some way the testing issue, and I think we do have to engage the county in the discussion. We don't have to. Doesn't mean we can't do our own independent testing program, but I do think we want to make sure that we're coordinating. So yes, let's put together a conversation. Let's put an agenda item together on that. Okay.
Thanks.
Hey, Mayor, if I could, one thing for Steve on the child care that you might be interested in that I know hasn't been updated to you all, but if you remember back when Eric and I were first working on it and the mayor, we had a partner in YMCA that would take kiddos that were under the age of 5. They still have openings. So if there are people out there who need, they're essential workers and they need childcare, YMCA does still have some availability. I know they're not free, but they also have a scholarship program. And also we worked with Child Action to get the vouchers, and they opened up those vouchers for us. They still have many of those vouchers available. People can still call Child Action and get a voucher to get their childcare paid for, and they can choose their childcare provider. So those resources are available, and there are still slots available in our childcare program too for essential city workers, frontline responders, medical staff. There are still spots open.
Good. Okay, roll call, please. Mindy on on item 23.
Councilmember Ashby,
Yes.
Councilmember Warren,
Yes.
Councilmember Harris,
Aye.
Councilmember Hanson,
Aye.
Councilmember Chenier,
Aye.
Councilmember Guerra,
Aye.
Councilmember Jennings,
Aye.
Councilmember Carr,
Aye.
and Mayor Steinberg.
Aye. That passes unanimously. Thank you for the item and thank you for the very important discussion. And it's led to a couple of report backs here and potential other action items for our council. Thank you. All right, let's move on to the telecommunications issue. This was a difficult one. And I want to thank Maria McGonigal for her leadership and her team in helping to negotiate this one out. Maria, are you presenting this?
Can you hear me?
We hear you, yes.
Okay. Hello, and thank you for that, Mayor. Good evening. My name is Maria McGonigal, and I'm your Chief Information Officer. And as directed by the City Council, staff have been actively engaged in for a number of months in a comprehensive review of the city's ordinances, policies, and practices regarding the deployment of small cell technology. This item is of immediate concern and it is needed now, as it governs how service providers develop critical infrastructure that support essential functions for our communities under the stay-at-home orders, such as essential city services, distance learnings for students who are unable to attend school, and remote work from home for many who live in the city. Staff presented to the Law and Legislation Committee on January 21st of this year. The item was forwarded to be heard by the council and passed for publication in full on March the 24th. However, due to the immediate emergency response by the council to the COVID-19 crisis, the item was postponed and rescheduled for today. I'm going to give you a little bit of background on what the city staff have done to get us to this point, and then I'll hand it off to the Public Works Director, Ryan Moore. So as you know, the city's authority to regulate the development of wireless facilities is limited. Federal laws and regulations issued by the Federal Communications Commission and state laws mostly preempt local authority. However, the city does play an important role in ensuring compliance with the law and meeting the needs of the community and businesses. In order to inform the discussion on policies to be considered by the City Council in accordance with state and federal and local laws, staff have taken the following actions. The city attorney has reviewed the city's legal authority to regulate wireless development. We've researched and reviewed actions taken by other cities. We've conducted a pilot study of the Pocket Greenhaven area to test installed devices for their compliance with FCC requirements. We've received and reviewed expert analysis on city sites of permits, measurements, and results. We've conducted a comprehensive review of the wireless development processes to align with best practices and the City Council's objectives. And we've held numerous meetings with the community, businesses, and cellular carriers. Staff have taken into careful consideration the comments received and are bringing forward recommendations to the council today on an ordinance, a master license agreement, design standards that reflect best practices on the knowledge gained from the input of a wide variety of perspectives. And as you've heard from many public comments received, there are widely divergent views on this topic. Staff have crafted recommendations that attempt to balance the many interests of the stakeholders. And I'd like to take a moment, just a special shout out to the City Attorney's Office, Jen Gore, and Public Works Department, Chad Copeman, and Darren Arcolino at the IT staff, who are available online to answer questions. They've been diving deep into this for a long time. And at this time, I'll hand it off to your Public Works Director, Ryan Moore, to provide an overview of the key points contained in the recommendation before you this evening.
Ryan?
Good evening. Can you hear me?
Yeah.
Okay. So good evening, everyone. I'm Ryan Moore. I'm your Public Works Director. Thank you, Maria, for that. So I want to go over quickly the package that we put together, again, in collaboration with the IT department and the City Attorney's Office. I want to echo Maria's sentiment. Jen Gore has done an amazing job in uncharted territory as we've crafted this package of documents. So what this is an ordinance, some design and deployment standards, as well as a master license agreement, which will together govern the regulation of small cell deployment in the city of Sacramento. So I'll first talk a little bit about the ordinance. What it does briefly is it provides a roadmap for telecom deployment in the city of Sacramento with respect to small cells. It specifies a reservation process and an application process for our applicants. It establishes timelines for city review, which are well within federal standards. So we are reviewing in shorter order than the federal government requires us to. It lays out the requirements for public notification before small cells go up in any location. It provides an exception process if city standards cannot be met by an applicant. It provides us alternative ways to get small cells deployed. And in the rare cases where that's not possible, there are provisions for an appeal process if the telecom applicant's application is denied. So we're asking for your approval of the ordinance tonight. We've also put together design and development standards. These won't be part of the council approved package. These are a living document that allows us to be a little bit more nimble as we learn and grow and as the industry changes. But what is in the design and deployment standards, they include provisions for aesthetics, provisions for the type of infrastructure that's available for use, how companies can attach their equipment to our infrastructure. It establishes priorities for locations of small cells within the right-of-way. It spells out the public notification process, specifically how that has to happen. It establishes requirements for carriers to demonstrate compliance with all FCC regulations once they deploy their equipment. It gives minimum qualifications for small cell designers and contractors who are working in our right-of-way. And it establishes site maintenance obligations for our carriers. So that the design standards in the ordinance are wrapped up into a master license agreement. And that's a comprehensive document that any telecom company would have to execute with the city, and it would globally cover all of their deployments throughout the city for anywhere they want to deploy. So they would still need to sign a site-specific agreement for any individual location they want to go in at as well. So again, we feel we've created a regulatory package which provides predictability and a level playing field for all applicants while also protecting the city's best interests. And we're asking for your approval of those items tonight. Myself and public works staff, IT staff, and city attorney's office are available for questions.
Ryan, thank you to you and your department, and of course the city attorney's office as well. I know this has been a very difficult and complicated issue. I want to ask whether Rick Jennings has any comments on this, because together with my office, he was very involved in helping to negotiate and reconcile the various pieces that lead to tonight's action. And I know you've heard from a lot of constituents on this one. Rick?
No, I thank you, Mayor, and I also want to thank the Public Works Department as well as the IT department and the City Attorney's Department in working with us on getting to this point. This has been a long time coming to get to where we are right now. And the thing that I really want Ryan and or Maria to speak on specifically is the public engagement in helping us to get to the point that we're in right now. Maria or Ryan?
Go ahead.
Yeah, okay. I can talk to that. We've had several meetings with the public on this item, as well as with the individual carriers to get their input in person, as well as we've had phone calls. We've had lots of interactive exchange of emails, and we've been collecting data from individual stakeholders since the fall, early fall. And we've been compiling that and trying to come up with a balanced perspective on this pretty contentious issue.
So with all the input that you've had from the public to date, do you still feel this issue is as contentious, or do you feel we are making progress with where the public is?
I do feel that this does meet many of the needs that the community had expressed about notification, about placement, and about aesthetics. And we had gone through each one of those. So in this ordinance and in the design standards, all of those areas are addressed. Did we go as far as everyone wanted to go on either side of the fence? No, but we feel like we've come to a middle ground that satisfies most.
Mm-hmm. And we are within the FCC guidelines as far as what we can do and what we cannot do. Is that correct?
That is correct.
So again, Mayor, I mean, it's been great working with all the departments to get to where we are now. I don't know that we'll ever satisfy everyone, but I think we've made tremendous progress with the master license agreement, with the ordinance that we're talking about that's in front of us right now, and especially adding the public notification process and the appeal process to it.
Yeah, I agree. I think that there was a loggerhead, if you will, between the community and the city staff, especially working together, and some of the industry partners, and it sort of delayed this coming forward. And again, even if it isn't perfect, and even if everyone is not completely happy, the major differences were reconciled, and I think it's a very good work product, and I'm prepared to support it tonight. Is Mindy, do you want to summarize any of the public testimony?
Sure, let me put on the screen. So we received 9 e-comments and then email correspondence, all of which was delivered to council this afternoon and uploaded to the website. So I have no new e-comments to share. But on the screen, you can see the e-comments we have received.
Maybe we ought to take a minute to look at them.
These were all distributed to the council and uploaded to the website this afternoon.
Okay. All right. Are there other questions from members of the council? All right, is there a
So-
motion?
So I'd like to move this, Mayor.
Okay, Councilman Jennings.
I will second.
Very good. Vice Mayor Harris, please call a roll call, please.
Councilmember Ashby,
Yes.
Councilmember Warren,
Yes, can you hear me?
I can. Councilmember
Yes.
Harris,
Aye.
Councilmember Hanson,
Aye.
Councilmember Chenier,
Aye.
Councilmember Guerra,
Aye.
Councilmember Jennings,
Aye.
Councilmember Carr,
Aye.
and Mayor Steinberg.
Aye. That passes unanimously. Again, thank you. It was very complex and important piece of work. And
Good job, Rick.
okay, we now move to item 25, which is the Joint City County COC Homeless Plan. Emily Halkin is here to present. I want to thank you, as always, for your outstanding work. This is been quite a process over the last couple of weeks to get us to a place where we have an unprecedented opportunity to actually elevate and expedite that which we have been working on doing for a long, long time. And with a full partnership with the County of Sacramento and our COC. And I'll turn it over to you for the details, but it's pretty daunting and pretty exciting at the same time.
Thank you. Thank you, Mayor. I'm going to try to share the screen. Can everybody see it?
Yes.
Okay, great. Thank you. Thank you. Good evening, Mayor and Council. I'm very pleased to be here tonight to discuss the work of the Sacramento COVID-19 homelessness response team. This has been a lot of work over the past few weeks, and we really appreciate all the support we've gotten from the offices throughout our work. The response team is a collaboration of City Homeless Services, the County of Sacramento Homeless Services, the Department of Human Assistance, the Department of Health Services, Sacramento Steps Forward, and SHRA. And we've been meeting daily, oftentimes many times throughout the day over the past few weeks to develop what we hope you'll think is a robust plan that focuses on a few different things. The first thing is trying to slow the spread of COVID-19 amongst our homeless population. Secondly, aiming to mitigate any impacts of the virus, not only on people experiencing homelessness, but on our homeless service providers who are on the front lines. And also which allows us to respond to some unique needs that the homeless population is encountering during this pandemic. And while the leads on this team are those of us like myself who work in the homeless services field, it's important to emphasize that this response plan is at its core a public health response and really informed and led by guidance from the CDC as well as from state and local directives, certainly contemplating funding opportunities, which I'm going to talk about in a minute, as well as best practices from some communities who are a little bit ahead of this, most notably Seattle. The response to the COVID-19 crisis, not just in homelessness, but everywhere, really requires a swift and comprehensive approach. And luckily for us, both the state and federal government have really stepped up with new funding to help support our efforts. This table here shows that collectively between the city, the county, and the continuum of care, we have access to just over $15 million, half of which is earmarked specifically for services for the homeless population related to COVID-19, and the remainder of which is intended for COVID-19 general responses. It's important to note here that some of these funds, specifically those from the state of California, the first 3 lines and the final line called HEAP, are potentially reimbursable through FEMA. And so as we work on implementing this plan, we're going to make sure to align those services which we believe to be FEMA reimbursable with the funds that we think we can recoup. The recommendation, which you have a very detailed document in your staff report, consists of 3 main products that we are looking to implement and really have already started to implement in many ways. I do want to note that this is in addition to other work that the response team is doing, including working on access to healthcare, a lot of technical assistance with providers with a lot of changing rules and regulations, and consistent and collaborative communication amongst the partners internally and externally. The three main areas of work, which I'm going to talk a little bit more about each of them in a moment, are shown here on the screen. The first is making sure that we provide support to our existing shelters and also other homeless services organizations. The second is expanding our capacity, and this is most important in the areas of isolation and quarantine for folks experiencing homelessness. And the third area that we are working in is our encampment response. Before I go through each of those three components, I wanted to review the prioritization approach. And as I said earlier, because this is a public health response, the prioritization for the efforts and the new facilities and new opportunities we're standing up is quite different than how we might approach the more traditional homeless sheltering options. In a more traditional homeless approach, we might look at the person's length of time homeless, the geography where they are experiencing unsheltered homelessness, their age, or their need to connectivity to broader social services to help dictate who might rise to the top of our queue. But for these strategies, again, because it's a public health crisis, the primary driver really is the presence or absence of health conditions in the population. And so you can see the prioritization here that we worked on with and led by the Department of Health Services of the county. And we have a rank of 1 to 7, with 1 being the most prioritized person and 7 being the least. And you can see the very top person would be any COVID positive person who is experiencing homelessness, regardless of age or health conditions. Second is folks who may be pending a test result or believed to be exposed, so it's at a much higher risk. And then going on down to the intersection of age, underlying health conditions, and presence or absence of symptoms. So this prioritization matrix is really driving a lot of how the community is going to interact with these new programs coming online as we speak. So the first component that we've been working on is support for our existing shelters. Our existing shelters have been amazing throughout this process. This is a whole new world for all of us, but they do play a very critical role in continuing to support those who are living in very vulnerable situations. And many of our shelters will also be providing the critical step-down sheltering for people who might be exiting an isolation or quarantine facility. And so the response team has recommended 3 ways to support our existing shelters. The first is we're recommending a contract augmentation for the 5 sheltering programs in the city and the county who either have intended to or already have expanded or adjusted their operations to be able to serve folks in our prioritization category. So these are the shelters who have added additional beds to provide some step-down quarantine, who are adjusting the layouts, and who are taking people who are on that level of vulnerability. The second, as available, we are working to order and distribute PPE for shelter frontline staff. Those frontline staff often are exposed in ways that medical professionals might be. Our city Office of Emergency Services has really been leading this effort with some funds that the city put out a few weeks ago. And has been able to help facilitate ordering and delivery of supplies to many of our providers, and we intend to continue that as long as we can. And the third component for our existing shelters is really training and technical assistance. There's a lot of guidance coming down from the federal government, from the state, and we want to make sure that we are available resource to them. So having weekly conversations as technical advisors is something we intend to do throughout the crisis. The second component is probably the one that's the biggest, definitely the most complex. It is the standing up of new isolation and quarantine shelters. And the response team is doing this in 2 different ways, again, informed by the direction of our public health officer. There's 2 types of expansion happening here. The first is what we're calling medically supported isolation care centers. And the second is the preventative quarantine unit. I just want to talk a little bit how they differ, because I think that will help you understand how the services are different. In the medically supported isolation care centers, these are intended to serve priority populations 1 and 2 from the chart that I had up a couple slides ago. Those are the people who have either been diagnosed or are pending a diagnosis or are known to have contact with somebody who are COVID positive. So this really is our population who we know has either had an infection or is very, very likely to be infected. In these medically supported isolation care centers, the lead staff is actually medical staff, and the secondary staff is really the shelter operator. So in these centers, which will likely be either or both, the trailers that we are working on siting at Cal Expo and or some of the new motels the county is working to get underway, the Department of Healthcare Services really is the project coordinator, and we are providing wraparound services in terms of meal delivery, security, connectivity to other providers in the community. In contrast, the preventative quarantine units are intended for the priority populations who may be showing symptoms or may be of a higher vulnerability, but have not received a diagnosis or are not under suspicion of having COVID-19. In those instances, the lead on-site staff is a contracted provider, much more similar to a shelter, and the medical services are coming on through mobile health clinics visiting on a regular basis. With the current funding that I talked about a couple minutes ago, we estimate that we can stand up approximately 1,000 bed spaces in these two components. The vast majority of those would be through a motel strategy that the Department of Human Assistance is managing, with some additional capacity in our existing shelters that I just talked about. The third component of the response plan is our encampment response. As some of you probably saw about 2 weeks ago, the Centers for Disease Control issued some guidance on how to address folks who are unsheltered during the COVID crisis, and provided some very direct recommendations to help people remain safely in place in an encampment. And in addition to that, wanting to make sure there are pathways to folks in encampments who may start showing symptoms to get into isolation or quarantine facilities. The encampment response has 4 main components shown here. The first is continued outreach and education. We know that encampments come and go, might move, and so we need to make sure that we pay attention to how encampments shift over time and assess camp conditions throughout the community. The second is delivering healthcare services through volunteer UC Davis medical students under the direction of the fire department medical director, providing some community-based screening so that as people start displaying symptoms in the encampments, we can make direct referrals as needed into a shelter or even into the medical quarantine. The third is food and hygiene. The current plan has the ability to distribute up to 500 meals a day, as well as delivery of some medical support should people need that. Many of our unsheltered homeless people used to be able to access food either by panhandling or going to a place like Loaves and Fishes, and we really want to discourage those activities and allow people to stay safely in their encampment by delivering daily needs to them. And also placing sanitation stations close to encampments based on the size and the need of those encampments. And the final part is just communication and reporting, and this is really critical. The encampment team is working with law enforcement, outreach partners to again, monitor sort of needs of encampments and as they shift throughout the pandemic. This plan requires a lot of administrative partners, and so this table just shows the lead as either the city, the county, or Sacramento steps forward. But so note that while we might be shown as the lead, we are wrapped around with support primarily from Department of Healthcare Services, emergency operations, and many, many community-based organizations. You'll see on this table that the city is taking the lead on the operations of the trailers at Cal Expo, as well as the expansion of some of the shelters that currently we hold the contracts for. The county is the lead for the motels, as well as some expansion of shelters they manage. The County Department of Health Services is managing the sanitation program in encampments, and Sacramento Steps Forward is managing the remainder of the encampment response, as well as standing up this really robust referral process that will allow community partners to refer in based on the prioritization that I showed a couple slides ago. While I am extremely proud of the work this group has done, and it's been a whirlwind, but an amazing opportunity in a very short amount of time, our recommendation is not without challenges that we're continuing to work through. And so they're detailed more in the report, but I think it's important that I acknowledge those because a lot of the work that we're looking to launch in the next few days is dependent on some of these challenges. First, capacity. There are definitely capacity issues at both the city and the county levels, as well as with our providers. Our providers of homeless services have stepped up in a huge way, but as you can imagine, they are challenged themselves in just maintaining workforces. So as we stand up additional capacity, need to think about how we can support them and make sure that we're not asking them to do more than they can manage. The second challenge, which we are making progress on daily, I had a few conversations today, is transportation. Our homeless clients will need to be going from various places throughout the community, encampments, shelters, the hospital, into different interventions. And transportation can be challenging for the homeless population, even without COVID, and then put that on top of it, it's definitely a challenge.
Hey, Emily, can I stop you for a second?
Sure.
I have a question just relative to staffing because, I mean, there's this huge push right now to do all we can for the homeless, and so what has been, I mean, some of the ideas or the response to being able to deal with the numbers of people that we're going to have to be dealt with, assuming that we find either locations where people can be housed indoors or between indoors and out. I mean, what's been the discussion around staffing, our response so that we can have a major impact on a major positive impact on what's going on?
Yeah, it's an evolving topic. Definitely at the city and the county and Sacramento Steps Forward level, I think that pretty much all of us have diverted our attention, at least right now, to COVID. So you see almost the entire workforce in the homeless division at Department of Human Assistance doing this. Sacramento Steps Forward is repositioning some of their navigation staff specifically to COVID. Some of our other outreach partners, Sacramento Covered, Sacramento Self-Help Housing, similarly are using existing staff who might have used to have a broader scope of work and pulling them into this response. Another thing that we've seen in provider capacity specifically, we did a call out to all of our shelter providers to see who had capacity. Some of them have some capacity, which is great. The one that we are going to work with immediately on the first motels as well as the trailer is Goodwill Industries. They are a parent company of 3 or 4 of our nonprofits in the homeless services, and they had furloughed a bunch of employees from other parts of their business, and they're pulling them back in. So, how long we can sustain that, I think, is a question, but everybody is sort of digging in and finding ways to bring resources, but we will at some point hit a capacity threshold.
Well, and this, after you're done, Emily, I want to raise, I think the $64,000 question here, and that is on the issue of rehousing. What do we do once people are indoors because of the COVID crisis to keep them indoors past the COVID crisis? And that's our great challenge and great opportunity. And so I want to focus you on that, but I want you to finish first. Go ahead.
I'm just about done. So that, and you actually just stole my next point, but it's fine. So another challenge is certainly rehousing. We know that we may have an opportunity to have many more people inside who we've ever had inside, but the stays are very short, especially in isolation and quarantine. Your stay may be as little as 14 days until you're medically cleared. So how can we create a system that we can also make robust rehousing opportunities for those people who otherwise might not have come inside? Certainly a little bit of challenges with coordination with the broader response effort. How does this fit into the broader efforts of the hospital response to the Emergency Operations Center? Like all of them, we are struggling with getting PPE for our frontline workers. And then finally, I just wanted to note the referral process. I've talked a lot about that, and I think that while we can operationalize it, I did want to underscore that this will be challenging for our homeless population. You know, getting into homeless services pre-COVID was very difficult and challenging, and now we're changing things up. So I just want to recognize that we're putting a vulnerable population into a place of unknown issues, and that could cause some issues. I finally wanted to end with a little bit of the launch plan. I know that this plan sort of represents a starting point, but I wanted to say we have been working before today on a lot of things. In late March, the County Department of Human Assistance did make some first motel placements through existing relationships that they already had with motel operators. To date, they have replaced 37 individuals and 17 families who were at risk. These are not COVID positive folks, but people who are highly at risk into motels, and are continuing to support them. Over this weekend, we expanded our North 5th Street shelter. That is a city operated shelter, and put in 20 additional people from the River District who also were on those high vulnerability, elderly, underlying health conditions. And
Can I ask
Sacramento.
a really quick question? I'm sorry.
Mhm.
When you say these are at risk, and I totally get that, but this kind of goes back to what Steve was talking about. Are we testing, or are these folks being tested so we know if they're positive or not?
No, and I should clarify, when I say at risk, I mean they are at risk because of their age or underlying health conditions, not that they're at risk of actually contracting COVID. We do not have broad ability to test. We are not doing any testing at the shelters. We don't have that capacity. You know, people are being instructed to go to their healthcare provider, and for our homeless population, many of them, their healthcare provider, unfortunately, is the ED or our clinic partners. But no, we are not testing. We are pulling people off that, based on underlying conditions, age, or other health conditions, we believe could be at risk. This week, as soon as tomorrow or Thursday, there will be the first leased motel that the county is pulling together. It's got 116 beds, will be online, and the referral process with Sacramento Steps Forward should be launched. They are starting to train the first referral partners, who are our hospitals, our shelter staff, and some of our outreach staff tomorrow. We are anticipating as soon as April 10th, but it could be a little bit later depending on some physical things. We will be able to open the Cal Expo trailers. And then just thinking beyond this week and into next week, we're continuing to expand the referral access to the broader population, continuing to lease up motels, and making the encampment response more robust. So with that, I will stop to say I'm available for questions. Chris Conlin is also here, and Justin Risley with the Impact team. All three of us are available for any questions.
Thank you again, Emily. Councilman Hanson.
Thank you, Mayor. Emily, I just had a couple of follow-up questions. I noticed that in the weekly report for Capitol Park Hotel, we've dropped the occupancy from what was around 115 down to 85. And I don't know if that 30-person drop is related to capacity or something else, but are we going to also be using that site in the near term for some of these placements?
So I don't know if SHR is on, but I do understand that drop is due to the fact that many of the people were double occupied into rooms. And so they, because of COVID, are, as people leave, reducing occupancy to a 1 person per room. I do believe that once that has been achieved, any future attrition would be backfilled. I'm not sure if SHR is on and could speak more to that.
I guess the concern is that there are a lot of people with partners who could occupy a double room. So if we're leaving rooms vacant, I think that we should always consult with the county and the public health experts, but I haven't heard that that type of situation is dangerous yet. So that leads me to the next question, which is, while we're doing all this work, and I've talked to the mayor and city manager about this somewhat, the transition piece of what happens after COVID, which the mayor brought up, I'm concerned that we haven't acquired any of the pallet shelters in the near term. We viewed those earlier. We've had several proposals. LA is now deploying them. And I guess as we go through this conversation, those are a turnkey solution. that would allow people to have an individual room basically at a very low price. And given the amount of money we're spending for leasing and other pieces, once those motels go back online for other guests, they won't be available, and we won't have placements to show for the money spent. So I would I would very much like to see us acquire a significant number of the pallet shelters, and if possible, deploy them to community groups that might be able to provide the wraparound services like Winter Sanctuary did for a while. Maybe people have parking lots at churches or other nonprofits that would allow people to do appropriate hand washing and sanitation much better than they're going to have on the streets. So I would like to see that as part of the work we do. I know this is the plan that the mayor worked very hard on and the county approved earlier today. I'm very much in support of it, but trying to get a little bit further down the line of thinking before time catches up to us.
I think one. I think one of the challenges with pallets and tiny homes is that in order to provide medical isolation and quarantine, not only do you have to have a single room, you also have to have your single bathroom and no co-sharing of eating facilities. And so something like that's why motels are so attractive, because they're self-contained. Now, that being said, something like a pallet could certainly be a step down or a preventative type of place, just like our congregate shelters can be. So it's something I just wanted to clarify that I don't believe it could be used for medical isolation.
Yeah, I wasn't thinking of the COVID positive patients or those who are at risk. I was thinking of the rest of the population.
I'm going to turn it over to my other colleagues in a minute, but I want to cut to a chase here. What one of the things that needs to come out of this again is a council meeting, I would say in 2 weeks, where we are specifically addressing the rehousing issue. And we need not only Emily, but our housing authority and Danielle Foster, our new housing administrator at our economic development department, to be working. I've already been talking to Danielle and Michelle about this, to bring forward a rapid rehousing strategy. And it needs to be done within the next 2 weeks. And it should include an efficiency housing strategy, including at least a consideration of what we do with WX and Meadowview in terms of we have the sites, we have the funding, because that funding is separate from what's being considered this evening. But if our time frame, for example, for WX and Meadowview is late spring, early summer, midsummer, and we are still in some kind of a COVID environment, are we going to be able to use the sprung shelter that we're planning at both of those sites, given the need for distancing? So on the whole rehousing issue for the people we're bringing into the trailers and the motels, in addition to the WX and the Meadowview strategies going forward, where we do have the money, I want to make sure we bring these issues back to the city council soon, so that we're not at the end of June, when the COVID period ends, asking, okay, now what do we do with the people who we have brought inside? Councilmember Guerra.
Thank you, Mr. Mayor. I'll start with the housing piece there. One, Emily, and this is to add, if we could look at using that the potential federal stimulus dollars that we're having to start looking at some quick construction of rapid rehousing. And one model that I think of that's got bathrooms, that is turnkey, that's only 18 days to construct, is manufactured housing. They do come with bathrooms, kitchens, and places to isolate, and there are different sizes. And we have manufacturers in our region here that produce them already. So one thing I'd like to suggest is that we look at those, because they, unlike the other products out there, tiny homes and whatnot, these have a 50-year lifespan that can be later moved and even set on a foundation that can be permanent housing for a long time. So I think we should look at opportunities that allow us to get housing quickly, but that also has a longer longevity towards the products and the money that we're using to get more out of it. The second question I had, the second issue, or more of a question is, my staff, I think, reached out to you about, homeless populations that are at risk, particularly, we were connected with an 80-year-old Spanish-speaking homeless woman who is looking for support. That to me seems to be a person that is at high risk and particularly vulnerable. How do they fit into the equation of being placed into or provided into a place in this scenario with the current process that we're doing?
Right. So it's a little bit of a balance between how far we go into the at-risk population versus the symptomatic population, because we don't know how big the symptomatic population is. But there is the intention to begin to take referrals this week from partners that include outreach workers, shelter providers, law enforcement have a link in, and hospitals, and then broaden those referrals to other community organizations very soon. So somebody like that and get lots of referrals like that would be eligible on the prioritization 4 or 5 or 6. And so it's really going to be a balancing of the capacity. And because we don't know how many people are going to need medical isolation, we're going to have to phase it in a little bit to make sure that we don't lean too far into at risk and not have enough spaces for people if the pandemic hits. So we will soon be starting the referral. I think it should start as soon as tomorrow or Thursday with SSF. And so if that person is not already connected with some sort of navigator in the field, we can do that, and they could definitely make the referral in.
And I guess my point to that is that, I mean, particularly from what we've seen, somebody that is 80 years old and then gets, the virus, it seems to me that they're in an extremely dangerous situation, particularly if they're living out on the street. So I know there's a lot of people working on how to best triage this, but I would hope that if we're looking at those that may be impacted, that may be a particular area that we pay some focus towards. So we'll go ahead and send this person again your way. I think she's looking for some help and in fear that she could get infected, and then with very little resources be in that critical situation. So thanks for your question, but I hope that we'll continue to look at the senior population exclusively that are that are experiencing homelessness.
Councilmember Carr and then Councilmember Harris. Vice Mayor Harris, sorry.
A couple of questions, Emily. Do we have any idea the size of the population that we're talking about, that we're targeting?
Not exactly. We know the size of the population who's experiencing homelessness and is over the age of 65 from point in time counts, and we know the number of people who self-report medical conditions. What we don't know, and I don't think have any way of knowing, is the number of folks experiencing homelessness who will become symptomatic or actually contract COVID, regardless of their age. If they're 20 years old, homeless, and get COVID, they will be at the top of the list over anybody else. And so, that's why the balance of these two approaches is so important. We do know that the homeless population in the point in time count, I think close to half of the population, maybe a little bit less, is over the age of 50. The guidance from the public health officers would be 65 and older. Health conditions are hard because we only know what you self-report, but we do know that the homeless population tends to be more sick and have more underlying issues.
And has the new information that's come out about the demographics of the people who are contracting the virus, such as people who, African Americans, people with from poor backgrounds, tend to get the virus at a much greater rate than the general population? Has that influenced what our view is on the population, the total size of the population that we're targeting?
So I have not seen anything specific to the homeless population and the intersection of race around this. We are leaning on the public health officer, which is simply looking at diagnoses. I don't know that they at their office have looked at that, but I can certainly ask that.
Okay. And does this plan expand the capacity of the existing service providers to the maximum? Oh, I lost your voice.
Sorry, I muted myself. My apologies. You didn't lose me. I don't want to speak for our service providers, but about 2 weeks ago, when we knew we were going to be launching this, we did a reach out to all of them, and I would say virtually all of them have, capacity issues in terms of maintaining their own operations. All of them also, though, welcomed and were very, very helpful in doing anything they can. So, I don't know if I don't think we have service providers who have staff who are not working right now. I do think we have some service providers who have the administrative capacity to add, but the scale and the time at which we need them to do it is a challenge.
Okay. So I've had at least one hotel owner come to me with at least 1,000 rooms that he could offer. What are the challenges of getting people into those vacant rooms?
Yeah, so we've gotten a lot of hotel and motel operators reach out. Our issue here is not access to motels. There are more than enough motel and hotel operators who are willing to lease us rooms. And the county Department of Human Assistance is leading that effort and surveying the motels for appropriate locations, appropriate amenities. They need to have exterior doors, not interior hallways, all those things. And we have plenty of available hotels. Our challenges really more are the wraparound services. Do we have the sufficient medical staff and the operator capacity, to your point? Do we have the ability to transport them if we lease up 6 or 7 motels throughout the county to get people there? Do we have the food delivery all figured out? So leasing motels, I've been amazed at how many motels have come forward. It's really heartwarming, but that's not our challenge right now.
Okay. And final question. I think the mayor is right on point. The big elephant in the tent is, what do we do after this? And where do the people go after we've had them inside? And I do think that's an appropriate issue for us to discuss.
I appreciate that. It weighs on me. Go ahead, Mayor.
I said, we're not going to answer it tonight, but Emily appropriately flagged it as one of the significant challenges. And I want to make sure we come back within a week or two with the beginning of a plan to dramatically escalate our rapid rehousing efforts.
I'm sure.
And I would say that we've had conversations with the State Department of Social Services, which is the lead state entity for the motels, which is definitely the largest capacity. And they are very cognizant of this as well and have committed to helping us through this. And they recognize that just because the emergency services declaration ends and the EOC shuts down and the pandemic might go away, doesn't mean that the folks we're trying to serve don't still have needs. So I'm very hopeful that the state will continue to support, but we don't have tangible things. And so I really welcome that conversation that the mayor's suggesting we have.
Thank you, Mayor.
Thank you very much. Vice Mayor Harris.
Thank you, Mayor. Emily, first I want to thank you personally because I know how hard you're working on these issues. The mayor is exactly right, and you are exactly right. We have a homeless problem here that it's not affected by the COVID crisis in that it's not going to reduce the numbers of homeless. We have the same problems that we had 2 months ago with a sizable homeless population and all the issues around getting them indoors, getting them sheltered, but getting them to the point where they can be successful in housing. So all of those issues have to be addressed. And in a way, the COVID crisis has given us an opportunity that we had been looking for a long time, meaning federal resources to do something robust and quickly. But I think the council understands better after your presentation that you can't just put the homeless population indoors and walk away. That doesn't work. It takes service provision. And without adequate service provision, this would be a very failed experiment. I agree with Councilmember Hanson. I think that pallet shelters do have a place in our future as we look at our response to homelessness generally. And Mayor, I really welcome that conversation about housing and how we're going to manage the population once we come through the immediate crisis at hand. But, you know, all the medical experts are saying that this is a first wave and that this virus, until we have an adequate immunization for it, will come back until many people have been infected and we have herd immunity. This is a long-term project. It's a long-term prospect, and so is homelessness. So what we need to do is capitalize upon this opportunity. And I think that you are leading the way, and Emily, and making a good job of it, as well as the other real bonus that we get out of this, which is deep collaboration with the county. And we've been looking for that for a long time. And interestingly, this COVID crisis has really got us working together and working together better than we ever have. Because if we're going to get on top of homelessness, it has to be a joint venture between the city and the county. We can't silo and do it alone. So, Mayor, I look forward to that conversation. It's going to be a very deep and robust one with many ideas to sort through. You know, just really what we've been doing, but now the resources are greater. And so the opportunities are great. I think that we have, I think, sort of a silver lining here in the end in terms of getting a very strong response to our homeless population and getting them indoors. So thank you.
Very good. Thank you, Vice Mayor. Any other comments from members of the City Council?
Do you need a motion, Mayor? I'd be happy to make the motion.
We do need a motion, yes.
I will second.
That's right. And that motion includes the direction to come back within the next couple weeks to tackle the rehousing issues and to update any parts of the plan that need updating.
Indeed.
Okay. It's been moved and seconded. What about Mindy summarizing public comment here?
I will share the public comment that I've received. I received no correspondence on the items, but I have received the following e-comments. The top 3 were submitted after your distribution of agenda packet materials today.
I just want to add, just reading Bob Erlenbush's comment here at the bottom. In real time, of course, the task force and the political leadership are all addressing some of the challenges in the first instance, including transportation. We're working with the hospital systems. I know that some of the council members and your staffs have been talking to regional transit and paratransit, and we're working every angle to ensure in the first instance that we can transport people from the existing shelters or the streets into these isolation trailers and or motels. So that's occurring, Bob, in real time. And it's not easy because if people are symptomatic, want to make sure that the people who are transporting the individuals have the training and obviously all the protection they need to be safe in providing the transport. Okay, 80% support. Let's call the roll, please, on the motion.
Thank you. Councilmember Ashby?
Yes.
Councilmember Warren?
Yes.
Councilmember Harris?
Aye.
Councilmember Hanson?
Aye.
Councilmember Chenier?
Aye.
Councilmember Guerra?
Aye.
Councilmember Jennings?
Aye.
Councilmember Carr?
Aye.
And Mayor Steinberg.
Aye. All right, go forth. And the county approved this morning, correct? Good. So we are lockstep. Thank you again, Emily, for fantastic work.
Thank you.
All right, we have one more item and it is related, and that is item 27 regarding the so-called Grove Avenue project in District 2. Who is presenting? Is that Tyrone? Do I see you up on the
Yes, sir.
screen? Welcome to you, sir. And if you start, then I'm going to say something. I'll have Alan Warren say something as well. Go ahead.
Very good. Well, thank you, Mayor, and good evening, Mayor and the members of the City Council, Chair and members of the Housing Authority Board. On February 18th, SHRA brought forth a staff report to house 48 transitional age youth in double occupancy cabins with the plan to eventually scale up to house 100 transitional age youth in 50 cabins. This met the goal of the 5-point plan and was done to meet the governor's 100-day challenge and to address the shelter crisis in Sacramento. Since then, SHRA staff has moved swiftly to make the project a reality. Cabins have been built with electrical connections for lighting. SMUD has donated air conditioning and heating units. The land is void of the foundations and trees that were there. It's been graded and trenched, and utilities for the final site work is anticipated on being completed this week. 18 cabins have been built, and the remaining 6 are in the process of being built once the 18 are cleared out of the space warehouse at Tough Sheds. First Step Communities are in the process of hiring staff, but given the pandemic ramifications and social distancing guidelines, we moved to adjust our original occupancy goals. We moved away from double occupancy in cabins and instead to 24 individuals housed unless they are existing couples. And priority would be given to compromised transitional age youth. At this time, $1,207,668 has been spent and obligated. 938 of that has actually been spent, and there is $226,058 left to complete the project. At this time, given the current crisis, we are here before you to receive guidance on whether to proceed with moving forward into the operations phase of the project. That concludes my presentation at this time.
Thank you.
We're available for comments and any clarifications.
Well, thank you very much. I want to start out here. This is a difficult one because SHRA and its leadership have done exactly what we asked you to do. We asked you to take on some additional leadership when it comes to efficiency housing and our homeless population, and you've done it, and you've put together a great project. And I know that it's had its ups and downs in terms of dealing with some of the prior occupants, and it's been complicated. But I just want to say that I'm very appreciative of what you have done, and that it makes this discussion a little bit painful because here's the issue. Though you have expended, as I think I heard it, close to $1 million thus far on the project. The overall project, where we hope to get to 48 of these cabins, and with the services around them for transition age youth, the total budget for the project out of our state HAP funds, which were the state dollars that we were successful in getting through the Big 13 mayors last year, the budget for the project is about 5.6 or $5.8 million, which means that almost $5 million is not yet expended. And so this relates to our previous conversation just a couple of moments ago. I'm not comfortable going forward with the full implementation of this project now, when over the next month, we have an obligation to answer the question around how we rapidly rehouse 1,000 or more people, and I think it'll be more than 1,000 people that we're bringing into these motels and trailers. And so I would feel more comfortable waiting before we decide to spend the rest of the money on this particular project, which is a good and great project because of the the very real possibility we may need those resources to aggressively jumpstart this rapid rehousing for the larger numbers of people that we are going to be taking in over the weeks ahead. And so I've talked to Alan about this because it's his district and he's put a lot into this as well. And we can hear from him next. I mean, we're not telling you to send back the cabins, by the way, that you've already bought. You could place them at the site if you wanted to. But that's the way I feel about this reluctantly. We gotta hold on because we may need that money for something else. Alan?
Sure. Thank you, Mr. Mayor. Well, this is a very difficult issue. I've spent a considerable amount of time talking to Pastor Joyner. And as those of you that saw this process play out, Pastor Joyner has been in the community for 40 years and he has had a lifelong endeavor to work with youth and emancipated youth. And so he, has stepped up on offering his church for emancipated youth. There was some discussion about him converting from emancipated youth to COVID-19 housing, of which he was not agreeable of. He had expressed to me that he had made his life's mission to work with youth and emancipated youth, and he wanted this project to remain emancipated youth. The mayor and I have had a chance to speak about it, and the mayor asked that if we slowed down on the project, would I have an issue with it because there could be some other emergencies, things that are more pressing that we may need the funds for. And so I said that I wanted to support the mayor in his request. And we talked about a 1-month delay, 30 days from implementation of the actual program and whom was going to be housed. Some of that 1 month might be some time to give the pastor a chance to really think about this crisis and maybe possibly change his mind. But under no circumstance did I really want the construction to stop. Those contracts have all been let. People have been working out there. We've invested over $1 million. And so I think that would compound the issue. But I think we're in such a unique time that the mayor's request to me said, Alan, if we pause just to see how this is going to play out, would you be agreeable? And I said, yes, I would obviously be a team player. This is a very trying time for our city. And if for somehow it can be demonstrated that the funds could be used in a more impactful way, maybe we could try to figure out another way. But in any event, the housing units, I think, is Councilman Hanson had mentioned with the pallets and Guerra with the pallets, and we're going to need housing and we're going to need rehousing for people. And so these units are going to play a role in our chain of trying to deal with the homeless community in one way, shape, or form. And so, but the mayor's request to me was that we delay for 30 days. And so I agreed to it. And I would respectfully ask my colleagues to do the same thing.
Thank you so much, Councilman Ryan. I do appreciate that. And I want to acknowledge and thank Councilmember Ashby as well, because she spent a lot of time dealing with the prior occupant here and trying to make this happen. And again, this is a necessary decision, even if it's a difficult decision to make. And I appreciate your support. Who else wants to speak on this? Anybody else? Angelique?
Yeah. I'm a little reluctant, but obviously if that's what you and Alan want to do, I'll follow suit. But I guess I just feel like we're so close to the finish line, and also we didn't. I don't know. Is Lachelle on the call or no?
Tyrone is on the call, and I've been talking to Michelle about. There's
Well,
Lachelle.
yeah, and Angelique, I've spoken to Lachelle, extensively, and the way I see we're really talking about just a couple of weeks delay because I mean, there's still work to be done out there before they can move people in, and I'm hopeful that over the next couple of weeks we can solidify our direction. Everybody can be on the same page, and then we'll make a decision as it relates to, you putting these units to use because a lot of people can use them.
But before I turn it to Lachelle, I just want to be honest about it because no, everyone's transparent here. It's a delay for a month, but it could be a delay for longer than that if we decide over the course of the next month that we want to redeploy these HAP dollars to get more people into permanent housing through this strategy that we approved just a few moments ago. So it's an open question, and I think I just want to be completely transparent about that. I love this Grove project. I want to do it. I'm enthusiastic about it, but I just think it's responsible to look at $5 million and to just take a pause and say, where is it best spent? We don't know. There'll probably be a fourth stimulus package. We know that FEMA is going to reimburse 75% for some of the motel strategy. So there may be other resources coming back to us, but it's such a fluid situation right now that I just want to hold on to that money for a month to see where it's best deployed. Lachelle?
Well, let me just also, this is Alan. Let me just also say that, my commitment was for 30 days. And I think housing is such a critical issue, and it's hard for me to see a better use at this point, but I'm open.
Okay.
But I have committed, and I'm going to honor that we would delay. The mayor has some ideas about what maybe is a better opportunity, and I'm willing to listen, and then we'll make my decision. Thank you.
Okay. Angelique, go ahead. I didn't mean to interrupt.
That's okay. That's okay. It's like opposite day. I feel like I'm me trying to convince you to do this project. This is your project. I know you believe in it so strongly, so I guess I'm a little bit surprised. I also know a person who falls right into this category, right? Who's a young transition age youth who's homeless right now, who's in contact with Lachelle and waiting for one of those units. So I guess right now he lives in front of Safeway, and he's literally just waiting for one of the cabins. So I don't know. Maybe I'm a little bit biased because I have a person's face in my head relative to these units. I hear what you're saying, Mayor, and normally would be like the argument I think I would be making. We flipped around here on this one, but which is really weird. But I just feel like if we got them built, you could change how you wanted to use them.
No, that's the problem. The pastor won't agree to that. That was one of the issues. We could stand them up and use them temporarily for the COVID crisis, but we talked to the pastor about that. He doesn't want to do it.
Yeah, I could see why he wouldn't do COVID because his church congregation is older folks and all that. But everybody,
and people live there too.
And they come to get food there. So the older people, I know they're not supposed to go out, but they're going there to get their groceries. So I could see why he would say no to that. But Mayor, you could use it for other things too. I think he'd be open to other stuff. I think it's the COVID piece he doesn't feel comfortable with. But I also think if that thing was done in a couple of weeks and it was all of a sudden full of formerly homeless young people, you would be so happy.
I would be very happy. It's just, I need to know whether or not we need $5 million to rapidly rehouse 1,000 or more people. So you're right. We're like that Seinfeld episode, the opposites here.
Yeah, it's weird what happened there. But I guess the reason I wanted to see Lachelle is because I'm sure you and Alan have both already asked her this question. I haven't because I didn't know. I mean, I knew we were going to talk about this. I just didn't think we were going to delay it. And I just wanted to ask Lachelle, like, if we delay spending any more money right now, how does that delay the project from your standpoint? Because I hear Alan and Daryl saying two very different things. Alan saying, I'm only good on waiting 30 days, and Daryl saying, I want to be really transparent. I want to wait 30 days, but in those 30 days, we might make another decision, and then that could mean we move forward on a different project. So can you just tell me what that would mean? Or you know that I know the one young man. Are there other people in the queue, or where is the project from a loading up position and from a delay position from your perspective?
So from a loading up position, there are transitional age youth who have already been identified. We have a very robust community of TAE providers who are all very excited about this project, and in anticipation of the project have already started to identify people through the HMIS system who would be candidates for that. In addition, there are currently 15 couples. So there are some TAE individuals who are couples that could be identified to stay in the cabins as well. And then of those, there are also some transitional age youth who do fall into this category of very vulnerable as it relates to COVID-19. So they're pretty much teed up to start housing people who fit our category for TAE.
And then the second half of that question, Lachelle, what would the financial delay mean from your perspective? I'm sure you're catching the nuance in the difference there between what the mayor and the council member are saying.
Yes, in terms of the financials, if we were to delay, we would incur some additional costs because we would need to have security at the site to make sure that there isn't any vandalism or anyone breaking into that. We've already had, even at the site during construction, where some of the construction materials and things like that have been taken. So I would be very reticent to just have those cabins sitting there without any type of oversight and security to make sure that they are kept safe for whatever use that we're going to have. So that is an additional cost that we would probably incur over the 30 days.
I wouldn't be too worried about that though. Mayor, I guess my comment is really to you because as an observer of this whole process, I don't know. I just think you would be so much happier if we moved forward and had transition age youth in that facility in just a matter of a couple weeks. I understand the predicament we're in now, and timing is, everything. But these kids are just as at risk as anybody else that are homeless. And maybe, just having people queued up seems very compelling to me. And just knowing you and how hard you fought to get this far, I don't know. I'll do whatever you and Alan want to do, but from my gut tells me we should just see this one through, that we could find funding for the others if we need it. That's just my gut, but it's really it's me reading really you, Daryl.
Well, let's take the month and see if we can get to yes on everything. Because, for example, there are a lot of other resources out there. I talked about the FEMA reimbursement. There's also SB2, right, which we talked about some months ago. Do we want to redeploy SB2 for these purposes here to deal with the homeless crisis, whether under the COVID umbrella or beyond the COVID umbrella? I want to get to yes on all of it for all the reasons that you stated, but I just want to take a step back before we commit to $5 million when we're going to be asking the question over the next 2 weeks. How do we fund a dramatically enhanced rapid rehousing effort for what could be thousands of people? And I just think that's the responsible thing to do. So maybe a month is, I want to get to where Alan and where you want to get to in a month. And maybe when we put other resources on the table and we understand how this could all work out, we get more clarity on the fourth stimulus package and all of it, it will all work out. And that would be my hope. And of course, I want this project to happen.
Yeah.
But that's the ask for now.
Lachelle, one last question. If we didn't stop today, if we kept going today, how far are you from the first person stepping into a cabin?
The majority of the cabins have already been built. Construction is finishing up. We would probably be within 2 weeks.
And we're not going to stop construction. That will continue to go forward. So I think the piece that the mayor is asking is just the implementation of in the programming around the cabins.
That's right.
Yeah, I guess what she's saying though, Alan, is rather than having people in there in 2 weeks, we would be 30 days out before somebody might go in.
I acknowledge that the transition age youth population that aren't at risk for the coronavirus are not going to get inside as early as they would if we went forward. I completely acknowledge that. And
here's what I would say: the mayor has a proposal. I'm in agreement with the 30-day delay, but that doesn't stop us or the mayor from coming back in a week or two, and we can make the change if necessary. But I believe that time is of the essence for all of these populations of homeless people, the COVID people, as well as emancipated youth and all the others that are out there. And these units, we got to keep in mind, these are exactly the units that we've been talking about as permanent housing. These could be permanent housing for people. It's not like spending a bunch of money every month and we're leasing a place. This is something that we will own and be able to continue to provide services to people. So, it is, I'm a bit reluctant as well, but I gave my word to the mayor and I said I would support it, and I'm going to support it for the 30 days. But I'm hopeful that everybody will be on the same page.
Maybe, Mayor, can we come back in 2 weeks and see where we're at? Because then you'll have the guidance. You'll know better.
I would say if we can in 2 weeks, yes, but the motion is 30 days so that we give ourselves enough time to be able to put together a rapid rehousing strategy that is funded.
Okay, but if we got more information in those 2 weeks that gave you a level of comfort, we could come back sooner.
Sure.
Okay.
Okay. Motion?
Mayor, Larry Carr and I are.
I'm sorry. Go ahead, Steve.
I think Larry might have been first.
Go ahead, Larry.
Larry, you're mute. You're on mute.
Having talked to some of the people who came to the council meeting about the project and the amount of energy that they brought with them, and then just looking third hand from dealing with the pastor there, I really think there's more on the table than $5 million. I really think the city's integrity is on the line.
Yeah.
And I think since we have jumped out this far, we really need to go through this. I'm going to support the motion to delay for 30 days. But that does not mean that I don't think this thing should not go forward in 30 days.
Okay.
And I have a confidence, Mayor, that you will go out and find the money and bring everybody to yes. Thank you.
I'll try. Go ahead, Steve.
Thanks, Mayor. Lachelle, one of the things that the staff report wasn't clear on, but I think I just heard Alan say, is that the horizontal construction that's underway would continue. Is that correct?
That is correct.
And how much longer is there on that construction?
1 week.
1 week until the utilities and other pieces are done?
That is correct.
And as far as the report, the staff report said that they couldn't build more of the cabins because their warehouse capacity. So do you anticipate the ones that have already been built would begin to arrive over the
Yes.
next 2 weeks?
Yes, absolutely. And once they arrive, they can build the remaining, I think it's about 6 units or so, very quickly.
So, given that, I just, I respect the agreement that the mayor and Alan made, but I think the points that Angelique have made are also very um, important to consider. I myself would like to come back in 2 weeks if possible, even with the 30 days. Once those cabins begin to arrive and are essentially turnkey, we'll be under, I think, a moral obligation and quite honestly, just a logistical obligation to have them occupied, especially with kids waiting in line, young people who need shelter. It's how I feel about the pallet thing as well. If we had those sitting in a courtyard for $3,500 each, and we had spent the $100,000 to get housing for 60 plus people earlier this year that I was pushing on the staff about, we'd have deployed those because we couldn't in good conscience sit on 60 units that could be readily deployed, and we would have more people housed for a pretty minimal cost. So I don't really believe in this moment it's going to, like Larry Carr said, be a great situation if we break faith with the community. But I do respect the idea that we're trying to manage cash flow and resources until we know more. But I just wanted to put my finger on the scale of coming back in 2 weeks here.
Okay, anybody else?
Yeah, Mayor, I'd like to just make one comment. And that is that there's a big difference between being housed and being sheltered. Of course, we're trying to affect both. The mayor is bringing up the point that, we are going to be sheltering a lot of people because of the COVID crisis. But then when we look at the real problem at the back end of housing, I think we have to be nimble and facile. I'm okay with supporting this 30-day hold. All of these projects are valuable, and getting people into shelter is very valuable. But getting them into housing is a greater achievement and a more expensive and more difficult one to do. So I think it's prudent to see where we stand in a couple of weeks. We will probably know somewhere between 2 weeks and a month where we stand with the federal funds, and those will guide our decisions. So I'm in favor of this.
Okay. Can we get a motion on the month with every good faith intention to come sooner if we have the clarity that we need?
So moved.
I'll second it.
Okay, please call the roll.
Councilmember Ashby,
Slightly reluctantly, yes.
Councilmember Warren,
I sit next to Council District 1, so I feel the same way. Yes.
Councilmember Harris,
Aye.
Councilmember Hanson,
Yes.
Councilmember Chenier,
Yes.
Councilmember Guerra,
Aye.
Councilmember Jennings,
Aye.
Councilmember Carr,
Aye.
and Mayor Steinberg.
Aye. Thank you very much for good conversation. Thank you, Michelle.
Mr. Mayor, before we move on, can I ask for clarification on who seconded item number 25? I have Councilmember Hanson is making the motion, but I didn't get a second.
Who did?
I believe it was myself.
Thank you, Vice Mayor.
Let's go back and look at the tape.
Yeah, there you go.
Okay, that is the agendized items. Are there council ideas and questions? I know I have one that I want to raise, but I'll wait for others. Okay. Eric? Councilman Guerra?
I didn't have my hand raised.
Oh, you didn't? I'm sorry. Did Larry Carr? No?
I think it was Steve.
Steve?
I have an adjourn in memory.
Okay, we'll do this first. I just want to bring up the issue of food insecurity here, which I know has emerged as a big issue among our seniors, among our working families, among our lower income families. And our office has been working with a lot of your offices on trying to fill the gaps wherever we can. And I know the Donate for Sacramento Fund, for example, its first investment was $180,000 or so to the food bank to be able to provide food for over 1,000 families of Sac City students. The reason I raise this here again tonight is that if you could all help continue to assess the food need in your particular districts, so that when I'm talking to the state officials and thinking through how we might respond as an overall community, you have a better understanding of where the gaps are and how many people are not getting the food that they need. District by district or area of the city by area of the city, we'd sure appreciate that. Julia Burrows on my team is taking the lead on this, and we all really want to be responsive here. So to the degree you can give us frequent updates on what you're seeing in your districts, I would sure appreciate it.
I have a comment.
Okay.
Yeah, I appreciate that. We're working certainly in South Natomas with Stanford Settlement, working with them on their senior project. They had, before COVID, been feeding a lot of seniors there in their senior center and are taking a different tack now. So I appreciate that opportunity. And I also just wanted to remind you that I need to adjourn in memory of a dear friend.
Yes, we've got a couple of adjourn-in memories. Any other council comments? All right, then, Jeff, why don't you start with the adjourn-in memory, please?
Well, thank you, Mayor. Just 2 days ago, we lost a community member in River Park. She was a community leader, a volunteer, probably one of the sweetest and most courageous people I've ever met. Her name is Shelley Hescock. She has given a tremendous amount to the community of River Park, not the least of which was her smile. She had contracted cancer a couple of years ago and fought a valiant fight. She'd been through several rounds of chemo and radiation and always she just bounced back and never stopped. She never stopped volunteering. Even while she was sick, she was out being a crossing guard for Caleb Greenwood Elementary School. Yeah, this is a hard one for me personally. She was a dear friend, and she really deserves the honor of this city. So Shelley Hescock, rest in peace, my dear.
Thanks, Mayor. So very sorry. Alan, Warren, who else had an adjourn in memory? Steve?
Yes.
Go ahead.
I'd like to adjourn in memory. I'm going to put a photo up here of Kristen Otto. Many of you knew Kristen Otto, member of the Otto family. Her brother was Carl Otto, who ran the business for a long time. Her brother Johan, who lives in Land Park, and her niece Allison currently is at the business as well. But she's a McClatchy grad, UC Davis grad. She passed away on Sunday as well after being in hospice for a few weeks, but she was on the Capital Area Development Authority board appointed by the city for 10 years. She was on the Library Foundation board for 7 years. And Kristen always had a way of making people smile. She was a bright light in every room she was in, but she didn't have a big ego. So she kind of was able to work with a lot of different kinds of people and was just a very special person in the way that she gave back to the community and was part of the community. And I think it's more than appropriate that we send our condolences to the family. And as we note these passings, including the two young people who took their lives, it's very hard for families because funerals aren't happening right now in the same way because of large gatherings being banned. And so a lot of people have to grieve separately. And so I just want to send out my love and our love to these families and to the family of Kristen Otto.
Thank you, Steve. Thank you. She was very.
Hey, Mr. Mayor, this is Alan. Can you hear me?
Yes.
I just want to say Kristen was a jewel. I had the distinct pleasure of working with Kristen back in 2006 and 2007. and very talented and just a wonderful person to be around. And I'm so sorry to hear both that Jeff's friend passed and or person that he knew and highly regarded, and Kristen. And I'm actually shocked because I had not heard that she had passed, Steve. And so thank you for bringing that to our attention.
Yeah, Mayor, I just want to thank Steve too. Kristen was a great friend, and I got to work with her a lot. I know Jay did too on the Library Foundation. She tried so hard to help us. She's a wonderful human being, and thank you for mentioning the two kids who lost their lives too. And I just, in all of that, I want to thank our chaplains. Our chaplains, both for fire and police, have been, working overtime on all of this stuff, and they went out to the homes of one of the kids today and helped walk them through what this sort of modified process will look like during COVID. Having to deal with saying goodbye to a loved one is really, really hard right now. So thank you, Steve, for that.
I think we're gonna be done soon.
In all their memories and this Holy Week, let us pray for everyone who's hurting because they've lost a loved one, because they're hurting through an unprecedented situation in our community. Let's continue to be strong and work together, everyone. Thank you.
All right. Thank you.
We're adjourned.